Okay, thank you. Nabila,
Okay,
I offer
thank
to you now.
Thank you very much, Lily. Thank you, Yeni. So now I would like to invite Daria and also Aisha to the front. We have 20 minutes for the panel discussion session. Yes, please welcome Daria and also Aisha. And we also have Lily, and still we have Satya online. And if you guys have any question, anyone have questions for four of them? Anyone? So thank you, Satya and Lily, for still joining us for the panel discussion session, as well as Daria and Aisha. So anyone have any questions, you can keep asking this for presenter and speaker. So I have my first question to Satya. Since most of the organization here, institution, already have their SOP, documented disaster management. From your experience, what are the biggest challenge to implement the documents? What are the biggest barriers that you think that could be a challenge to all these institutions?
I think one of the biggest challenges is making sure that you're able to do what you want to do. I think it's relatively easy to write a protocol, to write an SOP, and to have that on paper. It's making it actually happen that's hard, and I think that's where the practice in the form of drills or exercises becomes really important. And that gives you the opportunity to simulate a disaster, even if you're just collecting all of the individuals, and you just talk through if this were to happen, these were the next steps, and these are who are the individuals who would be doing each of those steps. Even just talking through it allows everyone to just hear how the plan works. For certain things, we do live action drills. So we do drills where we would say, if there were a fire in this building, this is how we would evacuate the building. These are those approaches, and those actions of simulations really help everyone just remember what the plan is, be able to work through the steps of doing the plan. But most importantly, if there's something that's missing from the plan, if you do a drill and then you realize, oh, we never accounted for the animals in this area, or we never accounted for the fact that this road is closed at this time. It allows you to then troubleshoot the plan and make refinements to the plan. So I think, the SOPs are great to have. They're really important and they're necessary, but you need to practice utilizing them, because if you don't utilize them multiple times over and over, it's hard to remember how the plan works. And then when it comes time for the emergency, it's hard to actually utilize the plan. Everyone's in a different state of mind, and instead of that being second nature, then it's a whole new thing to try in an emergency, and that makes it much more challenging.
Yes, true. Practice makes perfect, yeah? So there's one question actually from Nancy online for Satya, and I think it's good to share with everyone the answer can you please give a real-world example of using an ICS for a small planned event versus a large unexpected natural disaster? Maybe you can share the answer to the offline participant here.
Sure. So certain planned events, smaller events. So we're a zoo. We have public guests here at the zoo every day. So we'll have a similar structure for large planned events. If we're expecting, a couple thousand people to come for something here, that it was an out of the ordinary but planned event, we would have a similar structure where there is someone there's an oversight person or an incident commander But there's also, someone in charge of logistics, there's someone in charge of operations, and there's a communication chain there that's very similar to how it would happen if there were an emergency. But we do similar things for animal transports. If we know that we're moving a dangerous animal from, either into or out of the zoo, or we're moving them from one area to another area in the zoo, who's, the person in charge of that, and then who's responsible for each of the other individual parts underneath that, including the planning and the communication. Occasionally, we'll have things where we know there's going to be service work. So, for example, we've had times where we've lost power to part of the zoo, electrical power or gas supply because of work that's being done on a part of the electrical system or the gas supply. And so we know that we're going to lose power to certain areas. And so we use a similar structure so we know who's overseeing the work that's being done, as well as who's providing the necessary resources while that power is out, and how we're doing that. And really the main thing is just assigning knowing who has the responsibilities and who leads each operational team, as well as who leads the overall incident. And then that really is important, because those are the people who are doing the pre-planning, who are planning all of the events and all of the steps and making sure that everything is in order before the event, also leading the event during the time of the operation. And then also those individuals are doing the review of what worked well and what did not work well during each of their individual tasks.
Thank you, Satya. I think we have questions for Lily online. Yenny, can you help? None? No? Second questions? No? Okay. I have questions for Lily. So it's common in my place as well. When the animal facility have a very limited equipment and facilities to treat animal for emergency. Like, how do you prioritize? What can you advise them to do the bare minimum? Because sometimes we don't have all kinds of drugs that are needed for emergency. For example, what are the most important things that you must have on the list? Like emergency kit for any facilities.
Yeah, I think, again, as annoying as it is, it does kind of depend, and I would be happy to talk to everybody about what different materials might be the best for you all, but I would say some sort of catheters, ways to get IV access, and maybe even really big needles so you could place an IO catheter if needed, and fluids to give the animal, and epinephrine and atropine for CPR and for resuscitating the patient. I'd say those would be really, really good and kind of minimum. And if you could get some way to measure the pulse ox and the ECG, that would be great and a really good starting point. And then from there, I would work on hopefully getting an ability to measure end-tidal CO2 and hopefully measure blood gases or electrolytes. And you can always just build out, because obviously us ER and critical care people love to use tons and tons of equipment and tons of materials. So there's always more that we could add, but those would be kind of some minimal things that I would try to prioritize.
Thank you, Lily. Do you have anyone have any questions for Lily? Yes, we have one, Yenny, over there. Can you help me pass the mic? We have one question for you, Lily, from the participants here.
Okay, I have a question for Lily and also Daria. The first one I'm going to ask to Lily. First of all, thank you for the amazing presentation. My name is Rachel. I want to ask two questions. The first one is, in case of maybe infections or sometimes unknown fever origin, when do you usually reach out for antipyretic? Like, do you have a cutoff point for the temperature? Because usually some of the people here, some of the people in my center said that maybe if the temperature rises, it's because of the body reacting to the antigens, and we can sometimes just leave it or use other medication like fluids or antibiotic to deal with that. But when do you usually reach for antipyretic? The second one is, in terms of heat stroke, I assume that the animal is in some type of pain. So do you usually give pain medication for that animal? And if you do, what kind of pain medication do you usually use? Because I guess in those cases, the kidneys are pretty compromised. Yeah, I think those are my two questions. Thank you.
Yeah, those are very good questions, and you have identified some tricky things that we deal with for sure. So as far as antibiotics go, I don't usually give antibiotics based on a temperature necessarily. If the patient has had a normal stable temperature and then it spikes, then I do sometimes investigate if I think there's a new infection that I need to treat. As we talked about, sometimes you can have a fever from an infection, so that's definitely possible. But a lot of times in our patients with disaster medicine issues, if they experience traumatic brain injury, which we haven't gotten to yet, but your brainstem can get addled from that trauma, and so your body temperature can do a lot of crazy things just because your brain isn't responding normally. So you don't necessarily have the temperature as a super reliable reason to give antibiotics. So I tend to give antibiotics more for if they get really, really cold or really, really hot. For cold stress or heat stress, I will often be giving antibiotics if I think that the GI tract has died off and there's no barrier between the bacteria in their GI tract and their bloodstream. Then I'm going to be giving antibiotics to try and prevent the bacteria from their GI tract getting into their body. Obviously, if I see a wound that looks really infected on a burn patient and I think they need antibiotics, I would give antibiotics then. If they have no white blood cells, so if their white blood cell count is really, really low, because maybe the heat stroke killed all their white blood cells, and so they maybe need antibiotics to help them prevent an infection, or maybe all the white blood cells are really low because they have all gone somewhere to try and fight off the infection. I think all of those are different reasons that I would consider antibiotics, and I agree that sometimes just antigens or the brain can cause your temperature to go up, and I don't automatically give antibiotics for any specific temperature. And then as far as heat stroke and pain, I agree that they probably don't feel very good. I don't specifically know what pain they might specifically be in. At least for me, when I've had really severe heat stroke patients, they are pretty unconscious because their brain got cooked. And in that case, a lot of them have really unhappy hearts, and I have them on lidocaine CRIs. I don't know if you guys have a lot of lidocaine there, but that does seem to help a bit with pain and makes me feel like they have something on board to give them a little bit of comfort. But in general, yeah, I'm not giving them non-steroidal anti-inflammatories. I'm not giving them acetaminophen because their kidneys and their liver are really compromised, and I don't think they can handle that. I think if they were really painful and I was worried about it, I might consider low-dose ketamine or low-dose dexmedetomidine. But I actually hadn't really thought a lot about pain in them before and never really identified it a lot, but that's a really good point that you bring up. And certainly when they have sources of pain, like a broken bone, and they have heat stroke. It is a really tricky thing that I'm trying to manage. I know you guys have problems sometimes getting opioid medications because I'm spoiled and I like to use those. And then I do use ketamine and lidocaine and dexmedetomidine. And I will also use local blocks if I can to just try to help that patient not feel if there's a specific source of pain for them.
Thank you, Lily. Is that answering your questions?
Yes,
Yeah,
thank
okay.
you so much, Lily. I have one more question for Daria, if I may. So, do you have any experience using anti-anxiety medication to deal with regurgitation as a behavior abnormality in any animals or maybe even primates?
Can you repeat your question, please?
Do you have any experience using anti-anxiety medication or drugs such as those to deal with regurgitation as a behavior abnormality in animals? Because we have one orangutan that does regurgitation for quite a long time, and we put him inside of a forest enclosure. So that behavior may be because either he is anxious or maybe out of boredom. So do you have any experience with that?
Unfortunately, I didn't have like case like this. Yeah, I'm not sure that I can answer on your question. Like with behavior stuff, he regurgitate.
Yeah, he would vomit out the food that he ingests.
Yeah.
And then eat them again.
Because of stress, yeah?
Yeah.
Probably. Yeah, I didn't have any case about with regurgitation, but have you tried to use some anxiolytic drugs and stress-reduced drugs, or no?
Sorry, what was the question again?
Have you tried to use stress-reducing drugs?
Oh, we have not tried to use any medication.
Yeah.
Maybe Satya, do you have any inputs on this?
Sure, that is something we will see with some of our animals. Typically, we aren't utilizing those same anti-anxiety medications. If we feel it is something that is potentially due to boredom, we try and utilize other types of enrichment for training or even for distraction. And then we try and also identify if there's certain food items that'll be more prone to that type of trigger. So some of the sweeter items we have, some of the cereals and things, many of our animals will regurgitate and then re-ingest some of those food items more often than they will other food items. So we'll try and limit some of those sweeter, more processed foods in those situations. And then also, like as I mentioned, utilizing other types of either training or enrichment to provide some other social stimulus for those animals. But those are cases where I'm reluctant to utilize those behavior modification meds for that because it may just have a sedating effect. It may not actually treat the primary problem. This is it's unlikely to be primary anxiety as it would with some other clinical signs.
Thank you, Satya.
Thank you. Okay, thank you. That answered my question.
Thank you very much. Does anyone have any other questions? Yes, we have one at the back.
Oke, ini maaf ya saya pakai bahasa Indonesia. Ini pertanyaannya buat Kak Echa. Jadi tadi tuh aku lihat dari slide-nya ada perubahan yang signifikan dari progres Pak yang dari bulan Juli dan pakai di situ baru mulai honey dan traditional medicine. Boleh di share nggak pakai traditional medicine-nya tuh apa gitu? Terima kasih.
Oke, karena pertanyaannya bahasa Indonesia, aku jawabnya pakai bahasa Indonesia juga ya. Yang luka itu ya, Rifda. Oke, jadi sebenarnya tuh kalau di kasusnya Ramo karena kita udah terlalu banyak pakai medicine, jadinya untuk yang kayak luka-luka terbukanya kita mencoba pakai traditional medicine kan. Sebenarnya ini bukan kasus pertama kita mengincorporate kayak ethnomedicine ke dalam treatment kami, dan kebetulan itu di tempat center kami itu kan orang lokalnya itu orang-orang Karo ya, dan orang Karo itu emang terkenal mereka punya banyak ilmu dari bikin herbal gitu dari alam, dan kebetulan juga staf kami salah satunya juga punya ilmu tersebut. Jadi mungkin maaf kalau sama orang Karo kalau aku salah ngomong. Jadinya pas yang kasusnya Ramo ini kita sebenarnya custom sama mereka, kayak kita kasih tahu gimana lukanya bentuknya seperti apa, dan emang susah sembuhnya karena dia basah terus kan. Terus jadinya mereka itu kasih kita bubuk, bentuknya tuh bubuk, warnanya tuh hitam. Terus awalnya mereka bilang itu dicampur sama lemak ayam. Mereka bilang lemak ayam yang dilelehkan, terus dicampur sama pastanya, terus ditaruh di luka-lukanya itu. Ya, tapi kita coba juga buat kita campur sama madu kan akhirnya. Terus emang kebetulan karena kita juga selain support dari topical, obat-obat topical kan kita juga kasih obat-obat yang sistemik kan. Jadinya memang kebetulan juga progresnya bagus. Jadinya kita pakai terus itu sampai akhirnya lukanya si orangutannya tertutup. Jadinya begitu.
Let me try to translate that. So, so there is a question regarding the treatment on orangutan Ramo, and Asia explained that they are using traditional herbs medicine. It is homemade traditional herb medicine, custom made from chicken fat, and also herbs, and they are also using oral medication besides using the traditional herbs medicine. Maybe you can ask the ingredient more from Yeni and also Echa after this, yeah. Okay, so one last question before we end our session for this afternoon, before we are going for lunch. Any other last question for the panelists, for the speaker? Yes, Fina over there. Thanks, Paki.
Okay, thank you. I want to ask to Aisha, because we also have one cases about the head trauma, and our orangutan also have an incoordination because of that. I really want to know, does the same cases that you have with Ramo also that you mentioned orangutan has incoordination, are they correlated to the head trauma? That's the first one. And the second one is, on the first slide, you state like orangutan also have a swollen eye. I'm wondering if that because of the landslide effect, or there are because also correlation with the head trauma that can make any other causes trauma in the eye. And have you guys checked the eye also at that time, the ophthalmology testing and everything? Okay, thank you.
Okay, thank you so much for the questions. The first one is about the incoordinations of the patients. We suspected the incoordination was also because of she is endured such a really bad blunt force trauma. So, but at we gave her time to recover by herself. We also gave like ketamine CRI for her at the beginning. It's also for pain medication. So we did not force her to move very rapidly. And then for the second question is about the eye. Yeah, we actually suspected the eye thing is because of the increase of the ICP, but in our center we do not have equipment needed for the reading the intracranial pressure. So we're just going by the clinical signs that she's showing. So that's why, because of that, we think it's because of the increase of the intracranial pressure is also making the liquid inside of the eyes. It's also affecting that. So that's why we started to give the neuroprotectant medications and also hyperosmolar therapy. Thank you.
Thank you. Thank you very much to our online speakers, Satya and Lily. Give them a warm round of applause, and also Aisha and also Daria. So thank you everyone for today. We will continue our session at 2 p.m. Thank you. We will continue our session at 2 p.m. Please be punctual, everyone.